re-invite Dr. Debasis Sahu from India, whom
Thank you
we
so much.
already had in our morning session. But now it is his turn with the lecture Traditional and Alternative Medicaments During COVID-19 Pandemic for Public Health. Dr. Debasis Sahu, you may speak. We'll be happy to share your lecture and presentation now.
So, good afternoon, everybody. So, my next presentation is based upon some traditional and alternative medicaments that was used widely during the COVID-19 pandemic for the public health. As you all of know, that during the COVID-19 pandemic, it has a threat to the human existence, and it is one of the most worst case that has infected the humankind. Okay, so SARS-CoV-19, maybe it is an anthropogenic or maybe it is a natural, but it has caused a huge damage to both the mankind and the economy worldwide. But still, in India, we Indians have managed to keep this COVID-19 pandemicity in a controlled manner. This is due to the fact that we have prior knowledge to the different medicaments in Ayurveda that has been used before ancient times for the flu-like viruses. Almost we know that these types of medicaments were not actually for the pharmacological effect. Those are all types of a preventive measures. So first, let us introduce this SARS-CoV. What is SARS-CoV? So this is one of the prominent pandemic threat to the public health and human existence in the current decade, and it has infected almost whole world population that caused significantly higher morbidity and mortality level. So it was also declared as public health emergency by WHO. So this severity has caused acute respiratory distress syndrome that is basically caused by systemic inflammatory reactions due to excessive release of pro-inflammatory cytokines and chemokines by the immune effector cells, and possibly the rapid spreading of the diseases was due to the differences in the viral strains. So, although the fatality was higher in the other parts of the world, India has managed to control the spread of the disease despite of higher population density and minimal health infrastructure. So various types of medicinal system, traditional medicinal system that has been practiced in India, those are Ayurveda, Yoga, Unani, Siddha, and homeopathy. So these are all the traditional medicinal system that is practiced based upon the herbal and herbal based medicaments. These medicaments have also proved to be very, very effective in preventing the severity of SARS-CoV in India. So actually, these herbs and herbal formulation have antimicrobial, antiviral, immunomodulatory, anti-allergic, anti-asthmatic, anti-inflammatory, and antioxidant properties. So these formulations have already been established in the long time in terms of their regime, clinical study, composition, dose, and doses. So some of the formulations in Ayurveda that were used extensively during that COVID was Kwath, Guruchi Ghanivati, Agastya Haritika, Anuthaila. And in Unani formulations, Triyaki Arava, Arki Ajib, Kamira E. Banaspi, Kamira Maradwadi, etc. And in Siddha formulation, Levavembu Kudinir, Kamasura Kudinir have proved their medicinal and therapeutic potential in prevention of these diseases, reducing the severity of the diseases and also in treatment of diseases as complementary and alternative medicine system. So these are the different types of products and property that were in prevalence during the India by different types of uh, drug manufacturing companies. As well as in general, we generally use Chyawanprash. That is a mixture of herbal formulation that is effective against common cold and flu. So these are some of the resources that has been used during the COVID-19. You can see aloe vera is there, Androgapis panniculata, Envira ribes, Momotica cerensia, Cucurma longa. So these are the different types of plants and plant products that are being used. Those are having antiviral, immunomodulatory, anti-allergic, anti-asthmatic, and anti-inflammatory activity. So one of the study depicted for decoction of cassia is that the silver nanoparticle of Piperlagrum fruit extract has potential antibacterial and cytotoxic effect against cancer cell lines, while Tinosporia cordifolia has promising antiviral and immunomodulatory and thrombolytic effect. So some of the other herbal formulation is gingiva H. It is a polyherbomineral drug that was used against respiratory infections, acute bronchitis, influenza virus, etc. So it contains the different types of Ayurvedic things, and basically from Tinosporia cordifolia, as well as from different other plant species called as Ashwagandha, Yashtimudhu, and Guduchi. So we also used Chyawanprash. Dabur is a company, and Chyawanprash is a mixture of polyherbal formulation that is generally used as a dietary supplement against different types of as a supplementation as well as against different types of symptoms of flu, especially cold and flu. So these also helped in boosting the immunity of the body, and it has a composition of more than 40 herbal composition, and it has been already been tested, and it is in market for the last 100 years. Then kadha, it was a very simple and very effective herbal formulation that was used in daily household activity. So people used to drink this kadha in during the 3 times a day. Okay, so it constitute different types of herbals or herbs that were easily available in the market or easily available during that period. Those are basils, cinnamon, black pepper, dry ginger, and resins. So these helped in boosting the immunity of the individuals during the COVID-19. Then others are Ayodharbans, Samson Bhatti, Anutaila, Sudarsana Gandhavatti. So these are the different other Ayurvedic formulations that were used during that period. Along with that, Ayush 64. So this is also a medicaments that has developed by the Department of Ayush, and it has helped in improvisation of the symptoms of influenza during that period. Also, Quath and some of the homeopathy formulations that also help during prevention of these things are arsenic alba, bryonia alba, gelasium somniferens, and Crotalus horridus. So these are having different homeopathic medications that are being used during the COVID-19 and helps in different pharmacological important constituent that was used against those viruses. Some other formulations were Johan and Khamal Marwadi from Unani formulation. Other supplementations that were also used was vitamin C and zinc supplementation, which also used in helping our immunity to fight against the viral diseases. So thank you for your time and patience.
And many thanks to Mr. Ashish Sahu for the second time.